Okay, we're about to go. So ready when you are.
Good afternoon, everybody, and thank you for joining the annual general meeting of the Vale of York CCG. This is for the year that ended at the end of March 2021. So it's a look back at that year, but of course, we've got to be aware that this is a look back from this last 18 months around the response to the COVID pandemic and the unprecedented demands that it's put on all of us in the Vale of York, in the city of York, in our places, our towns and our villages. I just want to say at this point how proud I am of all our clinical and care professional colleagues of how they've responded to the COVID pandemic and how they've helped all aspects of the population in the Vale of York during this last 18 months. I am especially proud of all my colleagues in the Vale of York CCG, administrators, managers, assistants, clinical colleagues, and with what they've done to collaborate as a system with local government, with care homes, with all parts of all sectors to try and get us through this unprecedented crisis that we've had in the last 18 months. Today, we're going to do some statutory responsibility stuff, which is mainly around signing off our financial position. But we are going to also highlight some areas that we would like to share with you that has come to light over the last 18 months as well. The first thing I need to do is to sign off the minutes of the previous AGM. And as you may remember, that also was a virtual meeting at this time last year. So I've been through those minutes and there was no actions that pertain from those. So I will sign those off as a true and accurate record of that meeting. I'd like to now go on to introduce Michelle Carrington, who's going to talk about a patient story that has recently been highlighted to our committees in the Vale of York CCG. Over to you, Michelle.
Thanks, Nigel. So this is a story of Martin, and we've got a picture of him there. Oh, there he was. There he is again. Who's given us permission to tell his story, and it came to a recent Quality and Patient Experience Committee that we held. And this is about a really innovative approach that our Selby Town practices have taken to address lifestyle issues that have really been of significant benefit to their community. And Martin has experienced significant weight loss because what he's found is that the motivation that the initiative gave him to seek help has really saved his life. Those are the words that he used. And what the Selby Town practices did was work in real partnership with citizens and other partners from local authority to look at interventions for health that don't include those things that might spring to mind first, like medication or attending your GP's practice. And these are the words that Martin gave to us when he told his story. So I'm just going to read them out because it's important that we hear his voice through this. My job was very stressful with very long hours and I didn't have a lot of time to look after myself. After I took redundancy, my son was telling me I needed to do something. And I took that letter as inspiration to say, I'm going down this route. I need to talk to these people and see what they can offer and how they can help me. I had the first telephone call with one of the team and it was really, really good. I think we must have been on the phone for 2 hours. It was a great conversation. She went through all my issues and it inspired me to know there was something I could get involved in. Since having that telephone conversation, I've been coming to the meetings and trying to improve my health. I'm the luckiest person alive where I can afford to do it and I've got time to do it. I can take control and I'm enjoying my life. I've got 2 great sons, my wife, my 2 daughters-in-law, a granddaughter, and hopefully more grandchildren to come. He's also now attending, after being in the army for many years and being super fit, he's now already reaping the benefits of this programme. He's back swimming at Selby Leisure Centre and looking after his dietary changes too. And it's made a significant difference to his life. And he was really wanting us to praise that initiative in our Selby area. So that's our patient story.
Great. Thank you very much, Michelle, for running through that. And I know Martin was wanting to be with us today but was unable to. Hopefully we'll be able to share his story wider as well on social media to other colleagues and to the wider population. Thank you very much, Michelle. Now we're going to move on to Simon Bell to give us an update with the financial position.
Thanks, Nigel. If we can move on to the next slide, please. Thanks. So we will talk about 2021, but before we do, I thought it was worth a reminder that in 1920, the CCG broke even, so spent no more money than it was allocated for the first time since 2014-15. So that was after a few years of rebuilding the governance of the CCG and the financial control. But at that point, the CCG was still in legal direction, so that's still required through legal instruments to comply with directions issued by our regulator, NHS England, mainly under legal directions because we've not achieved sufficient standards of financial control. Heading into 2021, we were undertaking planning in the normal way, but as you can imagine, as it became clear that the COVID crisis was going to become a significant pandemic, normal national planning and timetables were suspended. The way we manage money in the NHS changed. We moved from an annual planning cycle to a half-yearly planning cycle to acknowledge that the pandemic was unfolding in a way that was unpredictable. And we're still in that 6-month planning time frame. The year was characterized by receiving guidance which changed, which came out late, and we had to respond to that as an organisation. We nonetheless submitted a break-even plan, and we maintained the standards of financial control throughout, whilst responding to the pandemic as was necessary. But as you can and also it's worth mentioning that in December the CCG was moved out of legal directions as a result of the improvements we've made. As you can see here on the slide, we planned for a break-even position in 2021, and that was what we achieved despite all of the volatility in the year and the need to respond to whatever clinical situation presented itself. We achieved all the standards that were required of us as a statutory organisation. So we achieved our running cost target. So that's the amount we're permitted to spend on management costs, the cost of property, etc. We achieved the mental health investment standards. So we're required to invest a certain amount of money every year in mental health services, which we did. We achieved our public sector payment policy, the speed with which we're required to pay our suppliers, and we stuck within the cash targets we had. Very pleasing for me was the quality of the audit reports, both internal and external, that the organisation had, which was testament to the controls we put in place, particularly in response to the very changing environment we find ourselves in. So a strong performance throughout 2021, which continued on the improvements we've made through 18-19 and 19-20. 21-22, we're still in that half-year planning time frame. We submitted a break-even plan, and at month 5, so 5/6 of the way through, we're still forecasting we'll break even in line with that plan. I mean, again, it's worth going back to those audit reports, for example, because as well as the normal statutory compliance, like value, true and fair view, and things like that, we also achieved a very strong value for money report. So as well as having responded to the pandemic through the year, we were also adjudged to have delivered value for money. That's probably enough from me, Nigel, but that's a quick summary of the year.
Great, thank you very much, Simon, for that update. I'm now going to move us on to highlight some areas to you. And next is our governing body member covering the City of York practices in the City of York population, Dr. Chris Stanley. Chris, over to you.
Thanks, Nigel, and thanks everyone. Good to see you all, and good to have this summary at the end of the year. I'm incredibly proud, really, to be a GP in the Vale of York. And I think this last year has been, whilst it's been a huge challenge, I think as most people experience, huge challenge comes lots of opportunity and ways of working, which has benefited our patients. So I'm pleased to be able to share some of that work over the last year with you. And if we just go to the next slide, there's a diagram here that was shared with me recently and kind of really resonated, actually, because I just feel like, you know, I'm sat in my clinic room here now. I'm kind of at the bottom of this diagram, sat with my patients face to face half the time, as most practices are. And what was lacking before the last year, or maybe a bit longer ago than that, that's developed even more, is all this stuff above us that's on this diagram, all this collaboration that's been going on at different levels. And I think that's been really helpful for me, sat down there with my patients, to think there's this whole network of people, organizations that are surrounding us and the patients to try and improve their quality of life, the care and the outcomes for the people of York. And so that really resonated with me. It's not been like that. You know, there's no two ways about it. If we went back before this last year, or probably a little bit further back, that kind of setup might have been starting to have a few bits of this colour in there, but there wouldn't have been this real wraparound that you can see there now. And that's been an incredibly positive thing for me. So what do I mean by all that stuff? I thought I'd take a few examples of why I think this network exists, or what kind of things have happened to give us that wraparound around the patients, the practices, right up to that ICS level. So if we go to the next slide, I've just pulled out a few things. You know, my colleagues in the CCG will be able to flesh out all the things that have been going on. There'll be a huge amount of collaborative work going on, but there's been some really successful partnerships. There's been the COVID vaccinations. I think everyone in York has had some input into that, whether they've been there as a volunteer, setting up, receiving their vaccinations, taking people. I mean, the setup of that was clinically led by the GPs and the provider organisation in Nimbus, but it took all sectors, and I really do mean all sectors, to get that to the success that it has been, continues to be, and will grow as well. And I don't think we've ever seen collaboration on that scale in those timeframes before. So that in the last year has to be applauded as a local success, but even more as a national success. I think most people would agree with that. That was a big headline grabber, but there was a huge amount of other things going on. There's Peppermill Court, which was a collaboration with the Trust, CCG, GPs, caring for those people with COVID that didn't need to be in hospital but needed some extra level of care. And to be able to quickly set up a service like that was really a proof of a concept that we can do this. When we work together, we can really get things wrapped around patients quickly when we work together. And that was shown again for the refugees, where we supported 260 in York with medical care, their health needs assessment, and the nursing team in the CCG, huge impact into that. And that's just taking a few things there to talk about care homes and SEND, all types of things that we should really celebrate in the last year. But I think the thing I wanted to really push is that it's been borne by this collaboration, this wraparound that I talked about earlier around patient care, and doing that through general practice, through primary care networks, and making sure that we take all the different sectors with us. So on the next slide, I've just tried to think about why why has that happened now? And there were signs that this was coming, this type of work was coming. There were small pockets of work. They stumbled a lot of the time, and they got caught up in contractual or organizational or governance issues. So it's really pleasing to see that some of that has been worked through. And once you've done that once, you've got a way of doing that again. So I wasn't quite sure why now, really. Obviously the pandemic has had a huge impact into accelerating different levels of collaboration. But none of the things we did were brand new things that could only be done in a pandemic. So I think there was an element of it born out of necessity, maybe. Maybe the promise or the threat of legislation change, that collaboration is going to be in legislation, whether that played a part, I don't know. But what I do know is that it's led to a cultural shift, and there's some things that I've put on there which I think demonstrate that there's a huge amount of trust gone into these collaborations. For organizations to step out of their comfort zone, work with a different organization in a different way quickly, you have to have trust in those people you're working with, and we've seen that. There's no way any of these services would happen without a huge degree of trust, and that's required a flattened hierarchy. No one person was better than the other, or organization was better than the other. They're all there to solve a problem, and that leads that needs and fuels mutual respect. I think in a lot of areas it went beyond that, and a lot of the services were genuinely compassionate. They were caring deeply for their patients, caring deeply about their system, caring deeply about their local areas, and I think that's come through, and we're needing it more and more as the pressure again begins to build as we're going into winter. So that's going to be really key for our system to take through, and all the time we're hoping this is patient-centered, and I think that diagram kind of represents that. It's all wrapped around the patient, and if we can carry on doing that, the next year is going to be equally, if not more, successful. We need to keep up that leadership. There's people leading in all different areas, but really it's a lot about local leadership, and the doctors, nurses, receptionists, all those people that are being leaders by demonstrating the behaviours that are needed for us to be able to work together. And then we need that right at that ground roots level, right at the top. And I think that's really where the CCG has to take a big prize for that, really. The guys presented here today, very modest, but they absolutely deserve our respect for the type of leadership and the behaviours that they have demonstrated. I think have permeated through all these changes to deliver all the services that we've managed to get up and running quickly. So that's can't go without notice. I need to temper the positivity, I guess, and say that it's not all roses. I think nobody would agree that the picture I've painted means we've solved all the problems that we ever had, and this is all we need to do. But I know that the people doing this work at the moment, leading these changes, the clinicians, the admin, every staff that we've got, we need to keep them together, keep them doing what they're doing, to plug all those areas that we still need to work on, and to continue to collaborate. And I'm tempering that positivity, but I am really positive about the next year as well. It's going to be really, really hard, but we've got the right foundations and the right people. So that's how I see the last year.
Great. Thank you very much, Chris. And I just echo your thanks and my thanks to the executive team who've really pushed on with that cultural shift and pushed compassion and collaboration throughout our system. So I want to and can applaud them. Okay, so thank you very much, Chris. So I forgot to say at the beginning of the meeting that we have apologies from Denise Nightingale today, but Phil Metham's going to make a few comments on this slide and on Denise's portfolio.
Thank you, Nigel. Good afternoon, everybody. Yeah, apologies from Denise, who was unable to join us this afternoon. But Denise has prepared a short video for us to watch at our leisure. So after this meeting, you'll be able to see that video posted on the CCG website with a link to YouTube. So I would encourage everybody to do that, and members of the governing body will know that mental health services are an area that has been prioritised in this last year. And what Denise has done in that video is she celebrated some of the achievements during the year, but also thanked a significant number of partners for their help and their contribution during that year as well. Two areas in particular that Denise wanted to convey as part of this meeting. Firstly, the significant improvement and achievement with regard to learning disability health checks, where the CCG has hit the national target 2 years ahead of schedule. Great thanks to member GP practices for their contribution to that. And also wanted to highlight the way that the City of York in particular came together during the pandemic to think about mental health issues and to work together to start to build more resilient networks and communities within the city to help us manage the growing demand for access to services that we are now starting to experience. So Denise wanted to thank and commend those two areas, and so I'll leave it there for now. Thank you, Nigel, and just encourage colleagues and residents to watch the video at their leisure. Thank you.
Thanks, Phil. Now we're going to move on to back to Michelle Carrington. So over to you, Michelle.
Thanks, Nigel. So it's been a tough year, and it was hard for me to pick out just some examples of the high quality care that's been delivered in the initiatives that's happened over the Vale of York, because there have been many, and work has continued, although it in the vein of COVID, and we've had to change and adapt and support each other in very different ways. So this isn't the entirety of what I could have mentioned had we got time. So I hope you'll find it useful. So next slide, please. So I just want to go through some of the ways that we've protected and supported our children and young people. Next slide, please. One of our really key areas of focus has been our SEND agenda, so those children and young people with special educational needs and disabilities. And we did talk about this at last year's AGM, but the work has continued really, really well, particularly in very strong partnerships with our local authority in the City of York. And we've worked with children, young people and their families to produce a set of outcomes that they want to see from our work. And you can see that on the infographic there. So lots and lots of very positive co-production. The CCG has financially added additional investment into therapies, because this is a specific area that are of benefit to children with SEND, some children with SEND, and we knew we needed to strengthen that area. We've had a couple of additional roles as well that have been hugely effective. One is to support the care planning of children and making sure that it's knitted together and it's connected for best outcomes for them. And we have appointed, who's just started in the acute hospital, a nurse who is responsible for coordinating the transition of children as they move from children to adult services, which is always a really stressful and difficult time for families. And then we've also invested in short breaks for disabled children in our local area, which is hugely beneficial for those children to network and meet their friends and different people that look after them, and also gives their family and carers time to recuperate and get some support. Next slide, please. We've strengthened the additional investment in our Maternity Voices partnership, which is led by a lay chair. You can see her in the middle there. And they work really tirelessly listening to the voice of pregnant women and new mums about their experiences of their care. And that's led to changes in the services that they receive and a better experience for everybody all round. Next slide, please. So how we've kept our children safe. It's been a really difficult time for children, locked away from schools when they were closed and out of sight and out of mind of some of their regular interactions. And what we saw through the safeguarding boards is a reduction in safeguarding referrals for children, which is not unexpected. That doesn't mean to say that there was a reduction in potential harm for children or concern, but that we weren't seeing the referrals from those people who would normally interact with those children, and that was of concern. So we had to adapt and change and make sure that we were still being able to reach out to them and keep them as safe as possible. And what we've seen is a steady increase in those referrals coming back to us. And not surprisingly, the complexity of those referrals have been of concern. But we have continued many campaigns, and the boards have continued as well, and done some really innovative and interesting work throughout the year. I just wanted to pick out a couple of those. So we didn't before have a strong adolescent strategy, and now we've got one in partnership with local authority and police and others. And the Trusted Relationships programme that we've been part of across North Yorkshire and York is a programme around exploitation of children, and it's been independently reviewed. And although it's early days, there have been some outstanding outcomes and examples of really good practice that have caught local and national attention. So we hope that will go from strength to strength. And within the integrated care system, of which the Vale of York is part of, we've developed, and I'm the lead for the first Children and Young People's Alliance, which is a group of people with a common interest to improve outcomes for children, working right across Humber Coast and Vale. And the programme manager for that is also Karen McNicholas, who's the lead for our children's services in the CCG. So an amazing amount of work gone in a very short period of time in order to improve outcomes for children. And we held our first Children and Young People's Wheelchair Forum as well. And it was really, really important to hear the voice of children and young people and their families when they use a wheelchair and what it means for them and the improvements that they'd like to see. And that's been a real strength. Next slide, please. And just those are some of the examples of the campaigns that have run with regards to safeguarding throughout the year. An awful lot of work there and different aspects to it. And importantly, the 1 minute guides, because it can be quite overwhelming, the amount of information that's out there, but the 1 minute guides for professionals, but anybody can click on the link there and get really quick 1 minute guides to all of the things that we've been doing. Next slide, please. I wanted to just share with you an example of Show Me That I Matter. This is the York Children in Care Council, which is run by the children themselves, children and young people themselves. And what they asked for during COVID was an increase in the amount of meetings that they had, because they knew that they were concerned about potential hidden harm for children not being at school and being locked down. And they've tried to reach out and support them as much as they can. And they also wanted to give something back. And this is an initiative that they did to support those heroes that they felt was around in our communities. And they were encouraged to create pieces of artwork and media. And it was hugely successful, and loads of people got those Heroes Awards, where they thanked foster carers, dance teachers, advocates, sixth form teachers, pathway workers, and many more people too. That was a really lovely thing for them to give back to the community. Next slide, please. Just some examples now of how we've helped our older population too. Next slide. So we work really closely with our social care colleagues, and NHS and care are absolutely something we're wedded to, and we are better together because of it in terms of being able to support our older people. Sorry, my phone is ringing. I just wanted to mention that, usually each year, if you've ever tracked these AGMs, we like to call out achievements for our staff, and this year Patient Safety Congress, we have the nurses within the CCG have been accepted to present 3 posters, and are also speaking at the PEC Congress about the work that they've done to prevent deterioration of residents in care homes. And it's a real chance for us to share our good work and practice with our peers. And we're also working in collaboration with 3 universities on the work that we've done in care homes as well. Next slide, please. And we have a forum called Partners in Care, because they really are our partners in care, people that work in social care under very difficult circumstances. And we have continued during the year to support them via programmes of work. And we've had, you know, over 600 attendances from over 80 organisations, and we've run, 25 sessions a week, not a week, in the year. But we've also added specific ones in where they've wanted it to, and we've worked with our palliative care colleagues too, to support end-of-life care, and done much more of that support within people's own homes rather than a hospice setting. And the infographic that you can see there with all the different colours on just gives an idea of the way that the team of nurses within the CCG work every day with our care home colleagues and those in the independent care sector, to support them and make them resilient and confident in the care that they give to those really important residents who are living in those homes. Next slide, please. We mentioned some of those successful partnership things through some of the things that Denise has said around the LD health checks, and Chris also mentioned the refugees as well. But the COVID vaccination programme has been hugely successful, and my thanks go out to everybody that supported that. I mean, as of last night, I'm just going to read the figure, that's 263,993 vaccines given since it started, which is 84.4% of the population that are eligible for it. A huge amount of work gone in, as well as keeping the wheels in motion on all the other services that we run. The COVID-19 hub was also set up, big partnership arrangement with community workers, with GPs, with practice nurses, with community nurses and others, where there was just one point of access for help for people, and they coordinated and worked together very well. And that is the future, really. You know, the walls come down within organisations, and we do what we need to do for the benefit of our population. And we've also led across the region a number of initiatives to support people with the Mental Capacity Act and decision making for people, especially when they don't have capacity to make their own decisions. And we've also led and supported an ethics group, as it's been very difficult during these times to sometimes make decisions about who gets care and who doesn't. That hasn't led to us having to deny anybody care, but they've been very knotty issues that we've had to work through. And that goes from strength to strength, that ethics group. Next slide, please. Of course, we couldn't do any of this without the support of the staff that work within the CCG and with partners. So I just want to give you a couple of examples of how we've supported them during this last year. Next slide, please. So we've enabled and established that home working, and I think, you know, it's revolutionised, has COVID, the way that we work and the way that we work with each other. And yes, Zoom meetings can get tiresome, but there are great benefits too of working from home. Some people are much more productive, they feel, and others don't like it. And we had to find really innovative ways of trying to support people during this time. We've rolled out React mental health training to line managers so that it can spot those early signs of people struggling and getting them the right support that they need, and also launched a series of support and training for staff to support those who are going through the menopause. Growing our staff for the future, we've developed a coaching and mentoring offer, and those that go through that will actually be able to offer that support wider than just the CCG, so right out across our Humber Coast and Vale to support wider colleagues. Next slide, please. And it's really, really important that we've encouraged that talent. You know, where is the talent within our organisation and what does the future lie for them? And as we've broken down some of those barriers of working together, it's really opened up their eyes and the opportunities of the roles and responsibilities they'd like to go forward in their future careers. And that's been a real eye-opener for them and really supportive. And we've encouraged people to test and try out and help
with colleagues. And we've had a number of staff that we've pushed out, if you like, from the CCG. We've had people working in GPs practices, we've had people supporting the COVID vaccination centres, the nursing staff set up a swabbing centre for NHS staff and patients in their own homes, stepping up to care homes. And we've had our admin staff helping support the vaccination centre in terms of queries that come through in their hundreds every day. So we're really pleased that we've been able to help our frontline colleagues in that way. Thank you very much.
Great, thank you very much, Michelle. So we're coming towards the end of our AGM, but we did want the opportunity to respond to some questions that we've had from the public. And we had a question from Helen of York Disability Rights Forum around what steps are being taken towards the integration of health and social care. And also, Helen also asked how are steps being used to be informed by people's lived experience. And Phil is going to respond for us to those questions. So over to you, Phil.
Thank you, Nigel. And thank you, Helen, for your questions. And the timing is great, actually. So it's a welcome opportunity for us to think about this with you and to talk in this AGM about how from next year we move beyond the work that CCGs have done and we move to a more place-based way of engaging with our communities. And so what that means, if I use York as an example, we will have for next year an alliance of all of the health organisations that provide care in York. That's either acute care or mental health care and support or primary care, all working together with other sectors. So in particular, the voluntary sector and crucially, the social care sector, both adults and children. That will involve creating a new way of working, and the leaders of those organisations have already committed to working in a different way to make sure that people with lived experience are able to shape the future offer of care and support and shape the way that that is delivered so that it is as bespoke as it can be to the needs of an individual and their families. Some of that sounds a bit like management speak, forgive me for that, and the leadership of health and care organisations in the city have recognised that. And so the chief executive of the York voluntary sector, Alison Semmons, has been asked to develop this new approach so that it is meaningful to all of our residents, and that it's particularly meaningful to those with lived experience so that they can genuinely feel as though they've got a role in improving and developing the care for themselves and their families and for others in the future. So watch this space, and as we go through the autumn and the winter, there will be opportunities for Helen and many others to get involved in how we start to create this new way of working. That is specific to the city, but equally there are initiatives that are being developed in Selby for the town and the district, and equally across the more rural part of Rydale. So all of the Vale of York should have a more integrated offer of health and social care service delivery and support from this autumn and winter onwards. That should be consistent with the changes that have been introduced nationally by government, but most importantly, it will feel as though it is making a difference and it is involving people in the communities of Rydale, within Selby, and within the City of York. So really timely and helpful question, Helen. And if you or any of your colleagues in the Disability Rights Forum would like to talk further with any of us about that, then you would be very welcome. And I'll hold that there for now. Thank you, Nigel.
Thank you, Phil. So finally, I'd just like to say thank you to our presenters today. Thank you to Simon for outlining the financial position, Chris for explaining what's been happening in primary care, and that work being led by our Director of Primary Care, Stephanie Porter. So thank you to you both, and for Michelle for outlining the issues around quality and nursing. The lay members and myself as clinical chair and the governing body members are very proud to be involved and to be working with this executive team at the CCG. And I just want to say thank you again to them and their teams for what they've done over the last 18 months and what they will continue to do, because we are stronger together as a clinical community, as a CCG, and as public. If we are stronger together, and if we think about the values of the NHS and everyone counting, we've got to be kind to each other as we go forward through the winter, and remember that COVID isn't over, but actually we will get through this if we stick to the rules and if we work together to collaborate. So just want to say thank you again for everybody's work, and thank you for watching today. Please take care and be safe and be kind to each other. Thanks very much.